Thank you very much for joining us this afternoon. I'm delighted to start the fifth series of Going Global with you all here today and with those joining on repeat after the session ends. I hope that it's okay, but we will be recording today's session for those who aren't able to attend, or for example, if you have to drop out at some point. I know that you've all got very busy day jobs. Excuse me. So we will be recording, so please do stay off camera if you'd rather not be caught in some of the screen captures or anything that happens throughout the day. But essentially, this will just be shared with those who have signed up for the Going Global series. So lots of health workers from across the NHS and globally as well. So the Going Global training series is designed to provide interactive and engaging sessions for NHS staff and medical students, and really to learn about global health activities from a wide range of organisations. And for the last few years, it's been hosted and organised by Health Education England and the Tropical Health and Education Trust, which is where I am from. So I'm Charlotte Aston and I'm the Head of External Engagement at SET. And the series itself seeks to kind of explore opportunities available, but also to understand, once you've found the opportunity or the activity that you'd like to become involved in global health, how you can capture that learning that you've gained whilst volunteering or whilst on a programme, and also then to explore sort of really important topics that need to be understood as you take part in these activities. So things from power and partnership relations, equity and inclusion, digital transformation and how to work in a new area of climate, COVID, Qs, and all the other Cs that we can think of in terms of global health. And one of our final sessions, really importantly, will focus on well-being as well. So your well-being and the well-being of those that you might go on this learning opportunity or activity with. So for this first session, we really just wanted to be able to sort of set the scene that we're all working within, the global context within which global health engagement sits. And that will involve presentations from the organisers of Going Global. So that's myself on behalf of SET and David Keane on behalf of Health Education. And then we will be joined by Charlotte, who is a volunteer or has been a volunteer herself on a global health programme, which is run and managed by SET and by the Commonwealth Pharmacists Association as part of the bigger Department of Health and Social Care in the UK's programme to tackle antimicrobial resistance. So some fascinating first-hand experience about the good, the bad, the ugly, but the brilliant side, hopefully as well, of global health engagement and activities. Please do put questions in the chat as we go along. We'll also pause, so please jump off mute and ask them out loud as well if you feel happy to, but really treat this as an informal discussion. We're here to answer questions and talk through concerns, and then hopefully we'll leave you wanting lots more at the end of today's hour session, and you'll join the following 7 sessions, which, as I said, all tackle interesting and very crucial topics as well. So to start us off, I'm really pleased to introduce David Keane, who is the Senior Lead for Education and Research at the Global Health Partnership programme within Health Education England. And he's going to set out why HE are here today, why they invest in this area of the health workforce, and perhaps some ways in which we can get involved as well. So David, thank you, over to you.
Thanks, Charlotte. So I'll share my screen. Always feel like I'm doing this for the first time. Okay, is that good? And I think I'm on mute though. Am I? Yeah.
No, we can hear you.
Oh, sorry. So as Charlotte said, I think the ethos today is quite informal, so please interrupt me. I know I've got some slides up, but interrupt me at any point if you've got any questions, or if you'd rather just put them in the chat, then please do. If I can't answer them, then I know people that can, so I'll make sure I get back to everybody. So yeah, so as Charlotte said, so my name's David Keane. I'm a nurse by background, but I work at Health Education England now, and I'm the Senior Lead for Education and Research in the Global Health Partnerships Directorate. There's my tweet handle there, but I have to confess I don't tweet that much, but There we are. I thought I'd put it on there. So first of all, I thought, so Charlotte asked me to go over kind of give a bit of background as to why HEE think that this is important and why we're kind of involved in this area. So this first slide gives some quite strategic statements that have come from our global strategy. But I'll talk through them in kind of real words rather than reading them off. But first of all, I think the idea is that we need global health workers. So we need people with a global perspective to work across all health systems, really, to keep the health systems resilient. We think that we'll be more resilient if we've got people with a global perspective working within our health system. And obviously people are integral to creating and implementing universal health coverage. We believe that mature health systems, and that's health systems such as the NHS, should be striving to offer global opportunities to both its own staff and to other staff around the world. So that is overseas placements or virtual volunteering for you, or it might be making sure that any migration into the country of health workers is ethical, first of all, and also offers them a learning opportunity, and we're not just taking advantage of health staff from overseas. I think the third one, COVID-19, we can't talk about health without mentioning COVID-19. And if there's any doubt of the interconnectedness of health systems, before the pandemic, I think now we all know that all of our health system is really only as strong as the weakest health system globally. So we have to work together to build strength within our health systems. And the last one is really focusing down onto individuals and this idea that if we support NHS staff to work and volunteer globally, then actually we know, and I'll come onto it a bit later on, but the evidence around the skills that people develop and the innovation that happens, and the fact that we actually overall we deliver quality care, often for less. So HEE are kind of working globally in three streams. I'm not going to go into all of these, but just to give you a bit of an overview, really. So we're first of all we're looking at the individual, so the NHS employee, and when we say that, we mean kind of people who are pre-NHS employees, so students and people who are training to join the NHS, and people who have just finished, so retirees as well. So when we talk about the NHS individual, it's the whole kind of scope of people. I'm going to go into that in a bit more detail in a minute. And then we've got another strand of activity which is aiming to work with the ICSs and the ICBs at a more system level. And the idea of that, particularly for people that are interested in global health, a big focus of that is actually supporting institutions and organizations to understand the benefits that they get if they support staff to go and work and gain experience overseas, and also working at a system level to support that kind of global integration and that global perspective. And then finally, we've got we work at a health system level, and this is much more government to government level, and we have a team who work with organizations like the World Health Organization and governments, and draw on NHS expertise to support health system strengthening. So the next slide, a little bit of focus on the individual development or the individual offer. So and apologies for the I know that I see the script there is very small, but I'll share the slides and they can be posted somewhere to read, but I'm talking through what's on there anyway. So the individual offer really is about working to support healthcare workers to work globally and to gain experience globally. We've got a lot of evidence that shows that if someone has works globally, then they build a lot of skills such as communication, cultural intelligence, my brain's gone blank now. Let me look at the list. Resilience and flexibility. So being able to work more flexibly, understanding how health systems work quite differently, and that people bring that back to the NHS. And we know that actually that can impact on the care that's being delivered, as well as a person's self-development and growth. But we also know that if we help work with institutions to support people to work globally, that actually that helps on retention and recruitment for that institution. So the institution gets something out of it beyond the training and organisational development of staff. So part of this individual offer then is to help what we want to do is help improve awareness and to drive engagement in this activity. So then I've got a couple of just case studies really of some of the work that we do, and then I noticed I haven't put on the slides, but I'll put into the discussion. There's a Global Opportunities website that the HEE team run, and there's regular recruitment there to the programs that we run at HEE. That's not to say that there's not loads of other programs that you can access, but so you can take a look at what we've got on offer. So the IGH program, or the Improving Global Health program, these are fellowships that are funded by HEE, and our fellows go out to different countries and will run and manage quality improvement activities. So there's two types of these fellowships. There's in-person ones that involve travel and working in the region, and then there's virtual fellowships as well that involve at-home support with teams overseas. Very much partnership led, so we don't just send you out and get you to make up your mind what you need. It's what our partners want overseas and the expertise that they need. So we match people up with the expertise and what the requirement of partners are, and we also link these fellowship programs to the wider work. So if you think about what I talked about global health systems work and our working with NHS systems, we're working on a model where we partnership regions, so that fellows will come from a region and will work with an overseas territory that's linked quite closely with the region in the UK. And then another example of some activity that HE has been involved in, and this is probably quite a classic way to get involved in global health placements, is delivering training. So this acute illness management for Africa was a co-developed training resource that was adapted from the resources that we have in the UK to make it relevant for an African context. So that means that medication, advice around different medications has to be adjusted because refrigeration perhaps isn't as reliable, that kind of aspect. And so this idea that people that we've got the expertise in the UK to share and teach overseas. And I think that's it, actually. Yeah, I think that's it. So yeah, I think there's something around the understanding the skills development that you get from engagement in global health, and there's thinking carefully, those of you that might need to make a case to your managers or to your organization. There's research out there, and I'm happy to share more with people about the meta skills development and particularly around leadership skills development that you gain from working in these environments, and this idea that actually when you're in a challenging environment, a challenging situation, that's when you learn the most. So thank you.
Thank you, David. That's great. Are there any questions for now? If not, that's absolutely fine. Think them through, add them in the chat box, and we'll also have some time at the end once we've all got through our presentations and thoughts to come back to David and to myself and Charlotte as well when we get there. So if there aren't any questions, I can't see anyone questions. Great. Okay, no problem. I will move on then. So next up, it's me, just to talk through so SET and how we play a role in this globally as well. So hopefully that has come through now. So yes, Going Global was established just before the pandemic, or a couple of years before the pandemic, and used to run as a one-day in-person workshop. And we brought together speakers such as myself and David and other volunteers like Charlotte to run interactive workshops. And since the pandemic, we've brought this online. And over the last couple of years, we've run this as a webinar series. So this is the third of our webinar series now. And as David said, I think the reason that SET and HE come together to do this is because we really believe in the benefits of global engagement for the NHS, for you as individuals, but also obviously for, excuse me, low and middle income countries and the health systems within which that you work. And that also might not necessarily be within low and middle income countries or health systems. There are a number of opportunities where staying in the UK and getting involved in global programs is possible, or of course in Europe and North America as well. So there's a huge array of activities and opportunities, and David has mentioned a few of the key Health Education England ones. So to put all of this a little bit more in perspective, I thought I would just talk through SET and how we fit into this. So SET, or the Tropical Health and Education Trust, is a charity which was founded over 30 years ago now by Professor Sir Elder Parry, who was a GP and a doctor working in Wales, who many years ago now travelled out to Africa and began his global work in Nigeria before moving on to Ethiopia and Somalia and Somaliland, and really worked with health institutions there, so hospitals, academic institutions, and health facilities and charities, to strengthen the health workforce by matching and pairing the expertise that was there in country across Africa and Asia with the expertise that we have back here in the UK, and really forming what we call now as health partnerships. So these strong links between health institutions in the UK and their counterparts overseas, all with this idea, with this vision of bringing about a world where everyone everywhere has access to quality healthcare. And with most of you working in the health system, I presume, many of you know how vital this is, and actually how taken for granted it is that even in the UK, this is not always possible. And it certainly has been challenged as well over the last few years with the pandemic and funding cuts and other areas. So we realise this is a tall order, but we've been working on it for several decades now and will continue to do so. And as I mentioned, the way that we do this is by running health system strengthening programs. And these involve everything from medical equipment and biomedical engineer training, all the way through to surgical interventions, nursing and midwifery programs, and leadership training for the kind of next level management of health systems. And again, to do this on a sort of more microscopic level, we run health partnership programs, so those pairing schemes, which to date have strengthened or worked with the health workforce in 31 countries. And the funding for this comes mainly from UK government, or has mainly come from UK government in the past, through the UK aid mechanism. But increasingly, with funding cuts within the UK government and the change in sort of the sector that we're working in, we're seeing more and more funding coming from diverse sectors, including large corporate organisations and foundations like the Bill and Melinda Gates Foundation, but also pharmaceutical areas like Johnson & Johnson or Novartis. And the way that we work with them is really to identify what's needed in country, responding to Ministry of Health requests or health system requests more broadly, and then building programs out for there. So I think what's fairly unique about that is that we approach it from what's needed and what's wanted by the health system and the health workers in it, rather than perhaps responding to sort of trends or where we see most funding flowing into, which makes our life a little harder at SET, but always a little more interesting as well. And crucially means that our programs focus on areas where often there isn't that much funding or dedicated focus on. And so it's often on some of the most neglected areas, including NCDs and leadership training. So as David mentioned, we support global engagement in the NHS as well, and many of those kind of surveys and research and reports on this and on the evidence base for global engagement and its benefits to the NHS, we also try to build upon and work with partners from across the UK and globally. So some of that sort of more recently focused in some work that we did with Ipsos Mori, who are a really large research organisation, who reached out to 1,000 health workers across the UK and surveyed them on their responses and their engagement with global health. And we really learned quite a lot from this. So we learned that in general, there's a huge positive sway and force within the NHS for engaging in global health systems, and a real recognition of the benefits that David mentioned, from learning to leadership, and from innovation to sort of cost savings and global connections as well, well-being, and a sense of sort of doing things that are supporting and helping health workers in similar or different circumstances, all with that idea of working collegially across borders to solve some of the global problems that we work with. And we've got a number of reports on our website, which we'll flood into the chat box later this afternoon. But they range from looking at the health workforce deficits with the African Centre for Health and Social Transformation, all the way through to working with the Welsh Government on ways in which diaspora health workers within Wales could be better supported. So a very diverse sort of set of partners and research. We also champion, as I said, innovation, learning and well-being through these programs. So we have in the past done a lot of work looking at what is sometimes called frugal innovation, what is sometimes called reverse innovation, but we just call innovation. And really it's just about learning from one another, ways in which we can improve our services in the UK, but also services can be improved overseas. So that's been initiatives like surgical mesh being transformed or used from mosquito netting in Tanzania, and the idea being piloted back in the UK, through to peer support workers who were identified as a fantastic initiative within Uganda, within the mental health system there, and that is now effective and up and running in East London NHS Foundation Trust. I think something like 250 peer support workers have been trained to date in East London. And these are previous service users, so those who would have been accessing some of the support and care that was available to them in East London, and then really wanting to share that learning, share that support that they had gone through, and themselves going to be trained to now be a peer support worker themselves. So now meeting with others in that community to help them through their mental health journey and ways in which that they feel supported and strengthened in that. So it's really been very rewarding and phenomenal to see really the bidirectionality of learning and innovation. And I think to that end as well, what we noticed through the pandemic was that there is a real trend in well-being here as well. We found that despite not being able to travel internationally and go about perhaps global program work as we would normally expect it, somebody hopping off a plane in Zambia or in East London, instead volunteers and health programs took it upon themselves to head online through Zoom, through WhatsApp and other forums to connect with one another. And following some research that we did at the end of last year and more work that we're doing this year, we really want to explore how that helps people through such a challenging time, both in the UK and overseas. And I think one of the greatest examples that we found to date was a way in which our former chair of trustees, who had retired as a nurse before the pandemic, Judith Ellis, and she actually was asked to go back into service to help in the Manchester Nightingale Hospital that sprung up in the response. She put back on her uniform and headed in, and she was able to use the conversations that she was having online with friends and colleagues in Sierra Leone and Somaliland to better understand how in a makeshift hospital in the middle of Manchester, which didn't have running water at the time she arrived and didn't have some of the perhaps more normal aspects of working in a health facility in the UK, how she could still provide care to those coming in. So buckets were brought in and sort of proper stations were set up for the use of that and the cleanliness of that. So that was all through being able to connect with colleagues and friends in Sierra Leone and Somaliland at the time, and over the years as well, and the learning that had come through that. So yeah, that was, I think, a fantastic example of that. But there are many others as well, for people who just found it useful to connect with colleagues overseas, or to make new connections with people working in health systems different from their own, and learning about what was happening, and really talking to one another about what was happening within that context. And I think to that end, we recognise experts in our midst, and that is, as it says on the slide, absolutely to do with diaspora contribution, but it's also to do with the contribution of health workers, patients, beneficiaries as well. So let's try to really champion the voices of those perhaps we don't normally hear from within global health. We're all used to listening to the WHO very closely, and various experts, but often I think we forget as a sector to really lean in and listen to staff in the wards working day in, day out, and the patients and beneficiaries who are accessing that care as well. So our latest sort of tilt in terms of policy and learning has been to look at the contribution that diaspora staff within the NHS are making to global health, and really that knowledge that they perhaps have of another health system or another context, and the way in which that plays a part in the UK's health system, but also then plays a part in the global health programmes that they support or volunteer through. So we're working very closely with trusts across the UK at the moment to establish a network that supports those people working within the NHS to share their contributions and to champion the voices that they have and the expertise that they have. And so finally, sort of all of that culminates really in a series of networks or communities that we build and hopefully grow year on year, which focus on the health workers that we work with and those that we don't, but that are interested in global health and are perhaps busy with other organisations getting involved, but that would just like a greater sense of community and a space to head to find out perhaps about the opportunities that David mentioned, or to find out about events or volunteering, like Charlotte will talk to in a moment as well. So a few of the sort of more recent developments in these networks are our Pulse network. So we'll share the link again, but it's pulsepartnerships.org. And about a year ago, this was launched. It now has, I think it's just over 1,000 members as of a few days ago. And these are members from all around the world, from Kyrgyzstan to Madagascar and from Zambia back to Scotland. So there are members from across the world, all with an interest and a passion in global health. Many of them are health workers, active health workers in health systems and health facilities. There are researchers on there, there are NGOs and charities like us, but there are also royal colleges and other bodies who support this sort of global health work. So I hope that you'll have the opportunity to learn more about it and other ways to get involved digitally in a few sessions' time with my colleague Kieran. But for now, if you are interested in joining the Pulse community, please do head there. It's completely free. There's an app as well. So if you're not on if you've had enough of your laptop at the end of the day, you can still plug in with your phone on your commute home or while you're sat on the sofa and find out what's going on and link in with colleagues and others across the world. The second network that we set up recently is the Health Advocates Network. And this was really in response to growing demand, I think, for the voices of health workers to be heard at key events and sort of captured within key reports. So we built this Health Advocates Network really as a way for health workers to kind of log their interest in being considered for speaking opportunities or for reports or for campaigns. So you can go into the network, and again for free and hopefully quite easily, you can log your experience and your interest. And it might be that you're happy to talk at an event, but you don't want to do anything with social media because it's just not your thing. And you can log all of that. And then organisations like SET or like FBDO or like HCE can head to the network and filter through all of these brilliant health workers and find health workers that perhaps fit events that they're looking for speakers for, or case studies that they'd like to build out for particular campaigns or reports. So hopefully it's just a fantastic kind of repository and a quick way just to note that, yes, you'd love to be able to support these initiatives. We'd love to be able to contribute in these certain ways, but I only want to be contacted about this, and this is how you can get hold of me. So again, please do head to the Health Advocates Network if that sounds of interest. And that really supports our bigger campaign, which was run over last year, called Health Equity for All, which was set up during the pandemic about a year ago. And that was really to engage kind of policymakers, decision makers within the UK who were fundamental in deciding where ODA spending went, where UK aid spending went, and where UK health system spending went. And we wanted really to make it apparent actually how big this network of global health enthusiasts is within the UK and across the world, and why this work is so important. So the Health Advocates Network just yet again sort of supports that campaign and supports all of the evidence that HE work really hard to generate, that SET work hard to generate, and that all of our partners in the sector work hard to generate, that demonstrates why this is so necessary as a part of the UK's engagement globally and vice versa. And then our final piece of the puzzle is a very exciting new part of it, and it hasn't yet launched, but I'm hoping to capture some interest from you all today and over the coming Going Global sessions, which is our diversity network. And again, it's really thinking through our experts in our midst that focus on capturing learning, expertise, experience from across the NHS to make sure that we're championing that learning, expertise and experience in every way we can, from NHS trust level all the way through to global health programmes and their design. So really building that out. My colleague, Dr. Kit Chalmers, is working on that now with a steering committee chaired by Dr. Navina Evans at Health Education England and a number of other experts. So if you're interested, if it sounds like that might be something you'd like to get involved with, please again do drop either myself or Daniela an email, or in the chat, of course, if you're happy to, and we'll love to sign you up to a mailing list for more news of that. But that's a space definitely to watch over the coming year. So that's set in a nutshell, in a rather large nutshell. So apologies for that and for the slideshow, but I hope that that sort of helps tie in how us as a global health charity and HEU form a partnership and come together, and why we feel Going Global is such an important initiative, but also just generally why we feel global engagement is so important for the UK's health system, for the NHS, and for wider health systems around the world. So I'll fall silent. I've seen some red pings in the chat, but I'll just do a quick scan. I think they're links, which is brilliant. So hopefully everybody's managing to access the links. Were there any questions or reflections that I can help with at the end of that? If not, I'll hand over to the much more interesting Charlotte on this call. You've got two of us today, and there's definitely one with more expertise and experience than me, which is our next speaker, Charlotte. So if there aren't any further comments or questions, great. So I'm really pleased to and grateful to Charlotte, who you can see is joining us mid-shift, which is far more impressive than my living room. But Charlotte is a consultant antimicrobial pharmacist, and I'm going to pronounce this wrong, so I apologise in advance, but at the Betsy Cadalwa University Health Board. And Charlotte's going to talk to us about her experience on the Commonwealth Partnerships Antimicrobial Stewardship Programme, and the way in which that volunteering experience and that global health engagement opportunity really went for Charlotte. And I think she's got some honest reflections for us all to learn from. So thank you, Charlotte. I'll hand over to you.
Thank you very much, Charlotte. It's very much like my partnership. We were two Charlottes and a Kenny when we went and did our global health partnership. So I'm quite used to the multiple Charlottes when we're doing things. So I've got a few slides today to talk about my my experience in the health partnership that I worked on. Can you all see that okay? Is that okay? And I've kind of chosen a bit of an analogy. So I live in northwest Wales, quite far flung, and I live near what I think is the most beautiful part of the entire world. Llyn Padan or Lake Padan that you can see there. So I've kind of linked it to Lake Malawi because that's one of the features that Malawi, which is the country that we're partnered with, and the similarities are actually quite similar between North Wales and Malawi. So a little bit about myself, first of all. So thank you very much for the introduction. I'm an antimicrobial pharmacist. I'm actually a consultant antimicrobial pharmacist in Betsy Cadwaladr University Health Board up in North Wales. And that covers the whole of North Wales. And I've always had an interest in kind of international development, as I'm a member of the Girl Guides. I'm actually a Brownie leader now. And I've been able to travel and do a little bit of kind of international development work through guiding partnerships around the world when I was much younger, before I had a family and that sort of thing. And then I went into my career in the NHS, and we do have some partnerships. Wales has a strong link through our Welsh government, through the Wales for Africa programme, and we do have some partnerships in our health board between different countries around the world, but there's been very limited opportunities. They tend to be more practical work and very limited opportunities for pharmacists. So it's kind of, I've had an interest and followed other things. I've been a member of the Commonwealth Pharmacy Association for a number of years, and then all of a sudden, there wasn't much happening, and then all of a sudden along comes CW PAMS. So this started up, it's the Commonwealth Partnership for Antimicrobial Stewardship. And as Charlotte said, it's funded through THET, and it's a grants programme based originally in with 12 partnerships. So the first funding scheme came along, you can see there, back in 2018, and ran for these 12 health partnerships. And they focused on things like antimicrobial stewardship and surveillance, increasing antimicrobial pharmacy expertise and capacity, and infection prevention and control. At the time, we considered in Wales applying for a grant. And I don't really know why, but we never really submitted the application and made it any further. So we didn't have a project in the first round of funding. However, a few years later, the funding comes back round again, and we jumped at the chance. And what I did was I signed up for an open session, which was kind of a bit like this, really. Come along, find out a little bit more. What does it involve? What is it? And so I signed up with that. And I'm very lucky in Wales. It's quite a small country, so we have a network of antimicrobial pharmacists, and we have a group. And so I spoke to the chair of the group and said to Kerry, are you interested? She said, yes, I am. Let's go out to the wider group, see if anyone else is interested. And that's when the other Charlotte came along. And we said, right, we'll go for it. We'll see what comes along. So we attended this open session, and there was a number of potential partners. Now, acutely aware that we were pharmacists and that we have a network of microbiologists and doctor and nursing colleagues that we could call on, but we were quite keen to have a pharmacy partnership, and kind of knowing what we'd done back in our antimicrobial stewardship back in Wales and how we'd worked, we were keen to have a network and learn internationally as well. And so one of the partners was the Pharmaceutical Society of Malawi. I have a little confession to make. Makanga is not a Welsh surname. My husband is Malawian, so there was a little bit of a maybe I understood a little bit more about the country, and I thought this would be really good. And we contacted the Felix, who was our named person on the list, and again he jumped at the chance, and that's when the partnership started. We were really lucky that the two countries, or the two sets of pharmacists, all of a sudden we had two groups, and we became one very quickly. Even before we had the grants and we had to put in the application, we could see the storming of a really good team and a really good partnership. It was really exciting at the beginning. What made it a little bit more challenging for us in Wales is none of us are based in the same part of Wales. We're spread out geographically, and also this is all starting during the pandemic, so we couldn't meet as a team. Our pharmacists, our colleagues over in Malawi, are not all in one location in Malawi either. They're spread throughout the country in different hospitals and healthcare settings. So we're kind of in the same challenges, but in the same boats. And I was really interested to hear you talk about different ways of global learning and different ways of working together. And for a long time, we thought there'd be never any visits during this project. We thought it would be virtual. Malawi was on the red list. The borders were closed, so there was no way that we would be able to travel, or vice versa, that was not going to happen. So we had two plans when we submitted for our grants. We had one that was we could travel. I may end up staying in one of those lovely hotels that were on at the time for quarantine, and that was discussed as a team. But we also had the plans of actually running the whole project virtually, and how would that look and how would that work. and I also really reflected on what David said, because I felt that was so strong. Flexibility, adaptability, all those things. And we did that together quite naturally as a team, but you learn so much, and that really comes back into your daily working life. All of a sudden you're far more resilient and you're far more flexible at everything that you do. And there was a great enthusiasm from day one from both teams. So we submitted an application, and we were really successful, and we got the grants. And what was really good is I'd involved my management from the beginning. I'd gone to the chief pharmacist and had that discussion before I submitted any applications, before I even really got further than, hi, Kerry and Charlotte, let's work together. I made sure that he was aware of what I was doing. He's been very supportive of my guiding travel, so I kind of knew I would be in a good place. And the other benefit of the partnership that we had, because it was Wales wide, the other chief pharmacists in Wales had spoken to each other. And as soon as one chief pharmacist said yes, they all kind of came along. And we have a very strong network, and we feed back what we've learned, feedback what we've done to that group of individuals as well, so that they've got the supportive management from a chief pharmacist level, but also then kind of the line managers of our team. And we were lucky in that sense. But also, I think they see the benefits of what we've brought back since we've been. We also in Wales have in each of the health boards a Wales for Africa lead. So I contacted ours up in North Wales. I made contact there so I could learn before we put, what have you done? How has this worked? What would you recommend? To get some really clear kind of insights into other people's projects that we thought we had an idea of what we were doing. I also am really lucky up in North Wales, and I'll probably talk about this a lot, but I have an infection prevention nurse colleague who's done some work for THET and Global Health Experience. So I tapped into his knowledge a lot as well. Again, it was all these networks through the board that they had for the overseas projects that we have in Betsy Cadwallader, that they could give me all information of people to talk to and gather information from. And Charlotte did the same in Swansea, and Kenny did the same down in Ynad and Bevan in South East Wales. And like I said, there were challenges. We planned to travel as soon as we got the grant early November, but Malawi went straight back onto the red list. That didn't happen. COVID was ongoing in both countries, and we're all healthcare workers, so we were all involved in different levels, both from personal health, but also working in hospitals. And our colleagues in Malawi work in tertiary hospital referral centres, so they were very busy during the COVID period. And so that did present challenges, but what we really learned quite early on is we're a team, and we pick up and cover each other and work together. So our project was around antimicrobial stewardship at 2 referral hospitals in Malawi, Kamuzu Central in the Lilongwe and Mzuzu Central in the north of the country. And the idea was to build professional capacity. Clinical pharmacy is quite a new concept in Malawi, and the pharmacists there are really keen. So not only were we going to do AMS and AMR kind of work, but also around clinical pharmacy and getting the pharmacists out onto the wards and working in the multidisciplinary teams. And then together we then we're going to educate and train pharmacy teams on AMS and AMR strategies that actually develop further than that. We've trained over 120 healthcare professionals in the 2 hospitals, and we've brought in, I'll talk about this a little bit in a moment, but we brought in laboratory staff to do look at microbiology testing. We also brought in infection prevention nurses, so we widened it out a little bit to make it a bit of a broader coverage and to encourage more good practice. And like I say, it was quite a short partnership that we had within a short time frame. And October to May, we have just completed all of our work and are currently doing our evaluation. So there's the team. That's when we first met up in Malawi, when we finally made it over there. But we planned weekly meetings. We met every week. We meet on a Monday at 11 o'clock UK time, 12 o'clock Malawi time. And again, we'd had permission from our managers to have time to be able to attend those meetings and run them. And we put plans into action, and we changed them again. We had a timeline, and then, well, different things happened. Our original plan was to go out and do what we call a point prevalence study out in Malawi, but we couldn't go. So adaptability, our colleagues then trained up teams in their hospitals and ran that to get the data collection for our foundation for our project. And we finally made it out in February to visit our team. Yeah, it was. I don't have many lows. I will try, but it was, yeah, wonderful. And post our visit, we then developed the full training that we've done together as a team. We've got an antimicrobial stewardship toolkit that we've done. One thing I would say is we were really ambitious in our plans. I think that was our naivety at the beginning. but the whole team together, we thought we could change everything in one foul swoop and that we'd get there, but our plans had to change. It had to be flexible, and actually we've achieved a lot, and on reflection we've achieved a real grand amount, but we'd even had bigger plans than that. And it's about adaptability and understanding that sometimes you may not have made it this way, but you may have done something else instead and achieved something in a different way. So one of my biggest advice is when you're planning, talk to lots of people, and even if you think it's a small change, it can be a big change as well. And don't be over ambitious, which we were. We were over ambitious. So we were a new partnership, and this is kind of a bit of our timeline of the way it worked. So we identified our volunteers in both Malawi and in Wales. We were kind of put your hand up if you're interested, come along and join the team. And we're now looking to get more volunteers involved. And we very much said it's not about the travel, it's about the partnership. So we don't expect everyone to be able to travel. We don't expect any of that, but you can give as much as you want. So we value your expertise, and we're widening our net a little bit around things like education and training and clinical pharmacy to support the network. We applied for the grant and got it. We then hired a project manager, one of the best things we've ever done in Malawi. Agri is amazing and keeps us all in track. And then we went out to visit, and we crammed a lot into the 10 days we were there, visiting lots of committees, groups. We did some ward work, and we started data collection. We did some data collection while we were out there. And actually we've won an award. We came highly commended in the Best New Partnership category for the Hub Cymru Africa Partnership Awards, which we're really pleased for a partnership of only a few months old. We were quite proud of ourselves, really. I've got some pictures then, because I always like a few pictures just to talk about where we went. So this is a presentation of the two Charlottes and Kerry, and then that's William, the president, and Agri, our project manager. Welsh Love Spoons are a thing. We took one out to kind of cement our partnership and way of working, and that was us meeting for the first time in Lilongwe. So what did we achieve? I've said a lot of this already. We did the global PPS to gather our data, and we're all the way at the other end now, where we're giving feedback and assessment on what we've done and evaluating what we've done so we can learn for the next steps. I think that's really, really important. Yeah, it's been a great journey along the way. There have been some highs and lows. I will promise I will talk a little bit more about that in a second. But all these things now we'll take forward for our next project and the way that we work together and share through the Pulse platform. I was really pleased to hear that, because we use that a lot in our development of what we were doing, picked up what other people had done, what other partnerships had done, used that, and then we will share what we have done on the Pulse platform as well. So that can be used in other countries and other health partnerships. Some more pictures. That's us doing some data collection there with Hannah, one of our colleagues, and pharmacists love pharmacies. So I've got lots of pictures of the pharmacy. We have a bit of an obsession. We also branched out and we made some further partnerships. The Fleming Fund have a big projects ongoing in Malawi, upgrading 8 of their microbiology labs. So we met with the lead for the Fleming Fund, because the two things kind of go hand in hand, and upskilling the pharmacists so that they can interpret culture and sensitivity reports, support stewardship on the wards, support clinical work that way. And so we met with the Fleming Fund. The training that we have done, they liked so much they're using it themselves. And on the right hand side is the lady in the middle. Dr. Elizabeth Bassani is the chair of the Antimicrobial Stewardship Committee for Community Central Hospital. She's now taken our training and has adopted it as a standard training for all healthcare professionals in Community Central Hospital, which is really exciting. The pharmacists there will continue to develop and deliver that programme in Community Central Hospital. Just some more pictures. We also took out resources that we got through the Commonwealth Pharmacy Association. We were given some games around AMS and different ways of learning and sharing those techniques and learning together, because we'd not used the AMS game in the UK and we found it brilliant. So since I've come back, I've used that as a training tool over here. I've been able to teach in a different way as well back in the United Kingdom. And that's Mzuzu Central Hospital and our colleagues over there. So the highs and lows. As you can probably tell, for me, there are a lot more highs than there are lows. I spoke to the other Charlotte in my team before I put this presentation together, and Charlotte what she found was one of her lows, was she found it quite difficult coming back to the United Kingdom, having worked in Malawi and shared those experiences. I think I had a little bit more of an insight because I've been a few times and I have family out there, but she found it very difficult coming back, having worked in a healthcare setting in Malawi, adjusting back to the NHS in the United Kingdom. However, what she does say is now that she's kind of acclimatized and got back to things, it's made her much more resilient, much more adaptable, much more flexible, and you can always find a solution to any problem that you have in the UK, because there's always an answer, because we're a high income country. And I suppose that's one of the lows, was the kind of the reverse, and particularly for us in pharmacy, because there were very few pharmacists. They're very keen to get more pharmacists. We're used to working with lots of our clinical pharmacy colleagues. They wanted out on the wards, they wanted to do all of this work, and so we hope to support them with capacity building and development of the profession that way, because the MDT, the multidisciplinary team, want them as well, and if we can support and work in that way. I came back to the UK far more enthusiastic than I've ever been in my 20-year career. I think I'd got a bit complacent, particularly post-pandemic, about the way that we do things and the way that we work, and this is the way it is, this is the NHS. And I met the most exciting bunch of pharmacists I've ever met, so enthusiastic to push their careers forward. And I came back with that thinking, we can push us further forward in the UK and in North Wales. There's more that we can do. And they're learning, and the way that they develop and of pushing their profession. I learned so much that I can bring back and do. And I also learned a lot around stewardship and the way in a low and middle income country. So Malawi, they have stock outages and difficulty of supply of medicines, which then impacts their stewardship. But then they've adapted and gone in a different way. And there's things that I've learned around how they do things that I've implemented in my own hospitals. So there's bi-directional learning is immense as well as all of that. The other challenge, being honest, really truly honest about it, is work commitments. And as I say, we've come through a pandemic and we're all healthcare workers, so it has been really busy and sometimes a challenge. But what we've also learned is to be honest with each other in the team. And if you can't do it, you can't do it. You just say it, and someone from the team will hopefully pick it up. And you are a team. We're not just the three of us in Wales. We've got our 6 colleagues in Malawi. We're a team of 9, and we pull on those expertise and work together and share everything. That's one thing I would certainly say. But why do this, and how? I never thought I'd get on an aeroplane. That's me on the left-hand side flying out to Malawi. I never thought we'd ever get on an aeroplane again for a very long time. I passionately love my job. I passionately believe about what I do in, and to see the same thing happening in another country has given me the real global perspective of antimicrobial stewardship, thinking this is a global issue. We can tackle it together. Working together in these partnerships grows both organisations, grows them so much. That's a view from Community Central Hospital up at the top right hand corner there, and I just thought the challenges are the same, the difficulties are the same, the ways of working, the ways people prescribe and they do things is the same, and together we can learn together to make sure that we strengthen both organisations to the best that we can, to provide better quality care for all of our patients wherever you are in the world. And I can't recommend it enough. And to bring it back to Lake Malawi, that's my colleague Nelson in the background. I haven't just put him in a picture. That's us on Lake Malawi on a little bit of time off that we did have while we were there. Slightly bigger than Llyn Padan in North Wales, I have to say. But yes, and I'm happy to take any questions at all. Thank you.
Thank you so much, Charlotte. I feel like I must have paid you for that, because I think David and our face was glowing because it was fantastic. I mean, I think if anybody ever needed a presentation to watch as to why they should volunteer and get involved in global health, I'll send them your way, Charlotte, because you've convinced me even, and I'm not a health worker, so I can't get involved in any of this. So it was fantastic. And yes, I can see already lots of people enjoying it in the chat as well. So we've got a few minutes left, which I'm very pleased we do. Are there any questions for Charlotte in particular, but David and myself as well, on anything that might have been mentioned this afternoon? I know that there was a lot of information to take in, and we'll be sharing with their presentations, if Charlotte and David are happy with that, and the PowerPoint slides with everybody who's on the call and those who are catching up later. Any immediate thoughts or questions from anyone at the moment? I know Wisdom asked a question about getting involved from Zambia, and yes, it's so our links with them are much more from the UK side of things, but I would say that that's where Pulse really comes into its own in allowing partnerships like Charlotte's and others to sort of advertise what's happening and to make links in countries where they're building partnerships and volunteering opportunities. So please do reach out to people there. There are often connections made between existing partnerships like Charlotte's or new ones as well at the beginning of Charlotte's journey as well, where they're looking for ways of matchmaking and linking up with health institutions. So do head there if you're interested in joining up with colleagues in the UK and overseas. So if there aren't any questions, I'm very happy to give everyone 5 minutes back of the afternoon to get cups of teas and hopefully enjoy a little bit of the weather wherever you are. It's sunny in London at the moment, so I hope it's sunny where everyone else is. But yeah, just to say a huge thank you to David and to Charlotte for joining today's session. I really hope that you found it as useful as possible and as interesting. And as I say, this is the first of 8, so we've got 7 more ahead of us. It sounds like a lot, but as Charlotte said, there's a lot to think about on your journey in volunteering or in programs like David mentioned as well. So please do join us for them. The next session is on gender equality and social inclusion. So some really critical topics and issues to think through about how we work globally and work with colleagues in the UK and overseas and vice versa. So please do join us for that. We're joined by some fantastic colleagues from Rwanda and in the UK as well. So it will be an excellent opportunity to hear similar health worker voices like Charlotte's and also some more from HD and myself at that. Thank you so much, everybody. Have a lovely afternoon. Thank you again, David and Charlotte, for joining us and for your time. It's been fantastic and I've learned lots. So I hope everybody else does too. Thank you.
Thank you.
Thanks, everybody. Nice to meet you.
Thanks.